made by Dr. Oz. Now, what's happening in this video while we're talking about it?
Well, you know, Dr. Oz is one of my favorite TV personalities because he always tries to help people understand their disease or disorder. So what we're going to show you in this video is something about show you about hysterectomies and fibroid tumors and how they can cause fibroid tumors. And we're going to give you a little commentary on, you know, what we think about the video and what we think your better option might be.
We're going to give you another option, basically. On top of the option that he gives you, we're going to give you an option. And hopefully you'll learn something from this video, because we learn a lot from this video.
Right.
And we're not trying to beat this video up or anything like that. We're just letting you know that there are other options. There are other options. Mm-hmm. And I think when you give people options, you give them opportunity.
Right, that's correct.
Okay, so this video, as this video plays, we're going to talk about the different things that we see in this video that can either help or hurt you.
Right. We just want to draw your attention to certain things that's going on in the video. It's a short video too. It's only about what, about a minute?
Not even that. 53 seconds.
Okay.
So what you just saw in that video was a uterus with the fibroid tumor in many different places. On the top wall, you saw it on the inner wall, you also saw it on the inside of the uterus.
That's correct.
Now, what is he saying? What is he doing right now?
So basically what he's showing you is that, well, first of all, it's important for you to have a visualization of what the uterus looks like and how the fibroid tumors can complicate matters. So when you see it on the surface, that's more of a cosmetic issue. It's not really, unless it gets really large and starts pressing on another organ, it's not really an issue. Now, when he's showing you inside, where it's inside the body, inside the uterus
inside,
and it grows big in there, and then it can start pressing down and cause pain during intercourse, it can cause bleeding, and so that's why he's showing you that there. And so then he also shows you them cutting the fibroid tumor off
the top.
Now, so that's a surgical procedure. They cut you open and make a small incision. They, go into right above the uterus or wherever the fibroid tumors are, and they scrape them off with a knife, with a surgical procedure. Now that can be painful, but that's how they're getting rid of the fibroid tumors.
Now keep in mind, this is an option that the medical industry uses to remove fibroid tumors. Nowhere in this method is there a option to do this without this method. We're saying, if you keep an open mind looking at this, if you got better option or another option, you might want to consider it, because what you're going to learn in this next scene is it gets worse.
Yeah, so let's give them a little preview of what's going to happen.
Okay.
So what they're showing you is they're correcting your fibroid tumors by cutting them off, but they're not addressing the cause. So, see, if you don't address the cause, what's going to happen?
And you're finna see what's going to happen when you don't address the cause.
So in other words, you can use this. You can use what most medical do. What the medical industry does is they address the symptom. They're going to cut off the problem and not address the cause.
So now watch what he does in this next scene.
Okay.
To addressing your symptom, because he's definitely not addressing the cause, right?
Right.
So watch what he does in this next scene. In that scene right there, he cut off the top. He said it was a myomectomy, but he cut off the top of the fibroid.
And you notice that it immediately grew back.
Now, why did it grow back?
It grew back because the cause had not been addressed. See, the problem with the
so it's an option.
It's an option. It is an option. It's an option. It's a quick fix option to fix your fibroid tumors, but it's not a permanent solution.
It's not a solution.
So, for example, if you have fibroid tumors because you have too much estrogen in your diet, then the fibroid tumors are going to come back. So cutting them off is only a short-term solution. They're going to grow back. and that's what he showed you in the video. Now, see, it's important to understand what he's not saying. See, when he's cutting it off, he's not saying that the cause was not addressed. He's saying, if they grow back, we'll do this. And what did he do next? He cut out the entire uterus out.
And he called it a partial
hysterectomy.
So your choices, your options there were to cut off the fibroids. If that didn't work, which not addressing the cause, we know it ain't gonna work, then just take out the whole, or let's leave the eggs, but let's cut out between them.
Right.
Let's cut out enough to where the fibroids are now all gone, along with a part of your body.
Right. So there's nowhere for the fibroids to grow now because you removed the uterus, which leaves you infertile.
Well, not only are you infertile, but there's another problem at hand, Todd. They're still got the same causes that they had that created the fibroids in the first place. What happens now? Where do they go?
Well, your body's going to find some other place it's going to find another place to hang. Not necessarily fibroids, it'll be another issue that'll come
It'll be a whole nother issue because he removed the one place they had to hang the trash bags. So now, if it hangs them someplace else, it could be a greater problem.
It could be something else. And so now this toxicity that was being held in those fibroid tumors is now going to be floating in your bloodstream and can cause other issues in other parts of your body.
Much worse problems. They're not going to talk about that. They're not going to tell you that.
See, because you don't understand is the reason your body is creating the fibroid tumors is because it's using it as a trash bag to contain something that it doesn't want in the body. So too much estrogen is causing, tissue growth. There's toxicity there, and so now if you remove the uterus, now your body has nowhere to hang that garbage.
Keep in mind, this is not to talk bad about the video. It's just to let you know, if you don't recognize that you have options, then you'll do something like this.
Mm-hmm. And this is permanent. This is nothing that you can reverse.
Yeah, you cannot go back and undo it.
And so
what we offer is an option that we know, not believe, know, based on nature, that your body is the only doctor.
Right.
Your body will not cut out the uterus to get rid of the fibroids.
Because if that was a viable option, the body would do that.
Thank you.
It would eject the uterus itself.
Totally eject it out, but it doesn't. Only man cuts away parts of the body that they think that's not necessary, that you don't need. Every woman needs her uterus. You were born with it. You should die with it.
Even if you're not even after your childbearing years, you still need your uterus.
You still need your uterus. So you gotta see this for what it is. Ladies and gentlemen, ladies, that's not an option.
Yeah. And even if you don't have fibroid tumors, it's good to take the herbs that will prevent you from having fibroid tumors in the future. Because what I've found is prevention is better than cure. So you want to take one of our fibroid formula, somebody's fibroid formula, even if you don't have fibroids, to prevent you from ever getting them. So you don't even have to deal with the situation where you have to get a hysterectomy. Because I know many of my friends that have had hysterectomies, and it's very painful for me to know that they've had a hysterectomy because I know they're on different, hormone replacement therapy. They're on Premarin.
Not necessary.
Their mood swings. It's complicated. It's a very complicated situation, and this is something that can be avoided if you have the right knowledge. So you can make the correct choice. You can make the appropriate choice for you. I'm not going to say the wrong choice or right choice, but the choice for you. Because some people, this may be the option that you want to take. They say, hey, I just want to have a hysterectomy. That's my thing. And I can't, I'm not going to beat you up or knock you for that. But I'm saying that we present you with another option that you can use to prevent yourself from having fibroid tumors, like our fibroid reducer formula. Then you don't have to go through this. You have to go through this, and you don't have to have the surgical bill. You don't have to, you might not, if your health insurance will cover some of it, maybe you have to cover some of it on your own. There's a financial impact of this, there's a health impact of this, and there's a, emotional and psychological effect of having these hysterectomies just like this.
We know that you have a better option. We believe you have a better option. So, with that being said, give us a call. My name is Forrest Gump.
And I'm Todd Lanham, and you can reach us at theurbanherb.net.
Or you can call us at 888-619-4372. Thanks for listening.
Thank you.